A very warm welcome to you, and thank you so much for joining our Homeopathy 24/7 podcast. We are going to be speaking to an array of international guests who will share their knowledge and experiences of homeopathy with you. We will discuss all types of subjects, such as remedies, symptoms, and stories of health. No matter where you are with your homeopathic journey, we aim to inspire you on your quest to natural health and living. The podcast is brought to you by Mary Greensmith, the founder of Homeopathy 24/7, which is a global platform connecting you with a homeopath wherever you are in the world, 24 hours a day. So let's get started with today's chat. Please welcome Mary Greensmith.
Hello, welcome. So lovely to see you. And I'm so pleased to be able to welcome Dr. Varsha M. Khurana. Welcome back, Varsha. How are you?
I'm very well, Mary. Thank you for having me again.
It's lovely to see you. And of course, we just love to talk about anything homeopathic. And we thought today we would concentrate on infertility because you deal with this a lot. You help a lot of people around the world. Tell me a little bit about what you do and how you do it.
Yes, I have been niching around infertility in the last few years only. It's not been a very, very long time. But at the same time, there was this case that I had. There was infertility of about 10 years standing, and it was kind of, I would say, myself miraculously, solved with homeopathy. That was my first case of, infertility that I treated ever. And that was about now 10 years back. That kind of uh, really encouraged me as to, because it just felt like in after that case, how that patient, the gratitude of the patient, and how they just felt like their life completely changed, because they were really wanting to have children, and it's a big gift, obviously, to have children. And it's becoming more and more difficult in today's times, as we are seeing it is increasing. The issues around infertility are just increasing in females and males. So it kind of like, because of how beautifully that case got results with homeopathy, it just kind of showed me that direction that I want to work for these patients.
And it is so lovely, isn't it? What I love about it is obviously the results are there. And as you say, the results are so life-changing. And the alternatives are so dramatic and so invasive in a lot of cases that we know that homeopathy is gentle, and homeopathy is about going back and addressing the cause, what's happening there. And as you say, we're seeing so much of it these days. It's just coming up everywhere, isn't it?
It's dramatically increasing.
Yeah.
It's alarming, actually, I feel, um, that and the multiple factors that are coming up to be associated with the causes of it. So yes, I think it's a very challenging niche, as well as very, very rewarding one.
Yeah.
So, and
Yes.
my personal, a little bit of, I will not say I had primary infertility. I would not say that, but I have also a history of miscarriages. So, somewhere I could kind of relate to what you feel when you can't,
Yeah.
what a woman really feels when they can't successfully do this. So it kind of really related to the entire diagnosis.
Of course, of course. And I know that you've just recently had a very good case. Can you tell us a little bit about that and about the circumstances and the remedies?
We'll talk about the remedies later. It's a beautiful case. I have put it up online
Yeah.
recently. After taking permission from the patient, of course. So visibly, I feel the patient. In case you have already seen the video, it is everywhere. So visibly, the patient is extremely young, and she's very young, vibrant looking, female with no health issues at all, and. She's what, all of 29, 28, 29. She started trying to conceive 2 years back, uh, and no result at all. Not even didn't conceive even once. um, sadly, at such a young age, people are going for IVFs, and this was a female who was like my very dear friend's sister.
Okay.
So that's how the case basically came to me. And when we started treating it, I just suggested one thing to her, that please stop the IVF cycles and all the hormones, the synthetic hormones, etc. For 3 to 4 months. I need 3 to 4 months to be able to improve the quality of eggs, because in her case the main thing, even while doing IVF, was not being able to retrieve eggs at that young an age. And even if there were some eggs that were being retrieved, they were not fertilizing at all. Not even a single embryo was being made, even artificially. So I just told her that I need 3 to 4 months to be able to improve the egg quality, or let's see if the ovaries need help, and what is really going on in the system, because it can be literally anything that is leading to that. So when I took up the case, there were two things that stood out. One was recreational cannabis use, which is, I think, very common now in young people. So I didn't think too much of it, but I just thought that maybe just detoxing cannabis could be the solution. Maybe her reproductive system was very sensitive, to the substance itself, and that's why it's reacting at this young age. So that was the first step that I took. I just detoxed
Yeah.
the effect of cannabis first with homeopathic remedies beautifully. And sadly enough, nothing much changed even after that. So she basically went back to IVF cycles, and nothing much changed.
Okay.
And I was disheartened, of course, that, okay, couldn't do much for her. But then she came back about 6 months later, and again, wanting to just go
Right.
off everything and use homeopathy, because somewhere she trusted me, or she trusted the process, or whatever I can say. So she came back to it. And then what came out was that she had a history of tuberculosis,
Okay.
uh, like many years back, long time back, and she had had anti-tubercular treatment for that. So now the tuberculosis was not really in the ovaries,
No.
never detected like that. All
Yeah.
right, but I was kind of convinced that it is the anti-tubercular treatment that could have
Yeah.
left that kind of a serious impact on the organs, and that the physiological function of the ovaries is absolutely doomed after that. And that's it. We focused on that, just treating the ovaries from the effect of anti-tubercular drugs in the history. And 3 months later, went in for an IVF cycle. I think about 6 or 7 eggs were retrieved, healthy eggs. 3 or 4 embryos were made.
Totally different.
Uh, Embryo transfer was done, and
Yes.
touch wood, she is
Yeah.
healthy today and pregnant with a healthy fetus. And she's probably in her sixth, seventh month already.
Okay.
So it was really something. I mean, it
And
was.
actually having that, going through the process of the cannabis and doing that first and that not making a change, it almost makes us realize how important it is to address the right symptom, to go back through that history and find the thing that was happening. And because you went through those two different scenarios, you know that tuberculosis medication really, really made a difference by giving that back.
Yes, yes, absolutely. So, um, great result in this case, and very quick as well. So it's all about, I think, just using the right remedy, and it's not going to take too much time after that.
It's very, very interesting. And so when you look at at the fact that it wasn't the tuberculosis, it was probably the medications for that, what do you do then? When you've got that information, what's the next step for you as a homeopath?
So I basically see. So there are two things you can do in this scenario. And I had both in my head at the time. But the first thing I wanted to see was that if there's any remedy that has an effect if ovaries are affected by the tubercular infection.
Yes.
So that was the first thing. And the second thing was that just go back and just detox that very anti-tubercular drug that was used.
Okay.
So these are the two things. So it just happened at the first step itself. So the
Okay.
remedy which when I went back to our source books and I searched for a remedy which had tuberculosis ovaries,
Okay.
there was only one remedy that was psychotic compound,
It-
psychotic cold, the bowel nosode.
oh, okay.
Yes, so I just used that in
Yeah.
LM potencies, increasing LM potencies over a period of 3 months, 1, 2, 3. That's it. And I didn't use any other remedy except that. And
Okay, so that's really interesting. So what you were putting in then was tuberculosis and ovaries.
ovaries.
Okay, health of ovaries.
Yes,
And that came up with one remedy, so that you were able then to give it, and by giving it in an LM potency, you were able to give it more often and going up in potency like that.
absolutely. Because I thought that the history is long time back.
Yeah.
So definitely there is damage there. So the physiology is definitely affected. So when I was getting this remedy particularly, then I kept looking for more ovarian symptoms in the remedy. And then I found inflammation of the ovaries in psychotic compound. I found ovaritis there. I even found pain in the ovaries. So that was missing in this case. There was no pain.
No, no,
She was healthy. She was very healthy.
yes.
And the other symptoms, like the inflammation of the ovaries, was also covered by it. So I just thought that this could be the right remedy for this case. And it did produce the desired result.
And what's amazing from that is that obviously you've got other people that saw that when the eggs were taken out, they weren't healthy, but after treatment they were healthy. Now that is huge.
That's huge because we changed the physiology of the ovary. We,
Yes,
we we normalized the physiology of the ovary, and then a normally healthy and a good quality egg was produced, like it should be at that age.
yes,
And the egg could fertilize, which was not being possible earlier.
yes, yes,
So,
yeah.
you know, so it is the whole thing. You have to boost reproductive health overall. The physiology has to be correct as well, to be able to it's it feels like okay, it's a normal physiological function for a woman, but it's a lot of factors working correctly, exactly correctly at the same time.
Can you tell us a little bit more about when they go for hormone treatment, when they go for IVF, they're given a lot of artificial hormones that you
Yes.
mentioned. And you said that it's important to stop using those artificial hormones whilst you're perhaps addressing, helping the ovaries become more healthy. Can you explain a little bit more about that?
Absolutely. So what they are trying to do is just the opposite of what we are trying to do.
Okay.
That's the problem.
Yeah.
So if I'm trying to optimize the reproductive health of any patient, and if artificial synthetic hormones are being pumped into the system at the same time, then the hormonal balance is going to be off. I'm trying to nudge the body to be in a hormonal balance because only then there will be good physiology.
Yes. Yes.
So, because I'm trying to do that, I want to remove that external factor that could be interfering with my treatment.
So for a lot of people, they perhaps don't realize that everything that they do and their health overall will affect the health of their ovaries.
Yes, like practically, yes. Like they're coming out with even alcohol
Yeah.
having a very bad effect on women in general. Of course, everybody, but women especially. because of our, special powers of our reproductive system, and uh, it has deleterious effects. So if something like alcohol, which is completely legal, which is a part of our society, can have that effect, then there are obviously a lot of things that we are thinking they are natural and normal, but they're probably not.
Okay. And also, I know that there's been a lot of discussion about certain vaccines that have been held or stored around the ovaries. Have you seen any changes in the last few years?
You mean the vaccinated patients
Hmm.
only? So, just in a few, I will not say in very many, but just in a few cases, I've had to use a bit of a detox for the vaccine.
Okay.
Not in all cases.
Okay.
So, I feel personally, I feel that in a lot of cases, when you use the remedy itself is able to produce that balance. And you do not need detox in every case.
Okay, that's interesting. So you find out. And so if someone were to come to you to become more healthy before trying to conceive, would that be useful? Would that be something that is sensible to do?
Absolutely, it is. Because even our diet, yeah, I feel that everything affects our fertility.
Yeah.
So it's a great thing if, so a lot of women obviously have um, early miscarriages as well. So those are the women I particularly encourage to use homeopathy for a few months before,
Yes.
so that we can, optimize the system, make the uterus a bit strong. Sometimes there's nothing but a bit of laxity of the uterus.
Uh-huh.
So we just want to fix that before they actually become pregnant, so that the risk of the early months miscarriage can be averted, you know. And that's what my personal case was all about as well.
Okay.
So there are women who will just get pregnant and everything will be 100% fine. They'll be exercising, they'll be doing everything, and the baby comes out just healthy, right? There are no issues. But there are women where, like I, for example, was really even sensitive to ultrasound during pregnancy.
Okay.
It happened to me actually twice that I got the ultrasound and I started bleeding.
Oh, that's really interesting.
And sadly, nobody talks about it.
No, 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 they don't. They
Nobody
don't.
talks about it.
Okay.
So that's the sad part. I just want people to know that some people, I'm not saying everybody, but some people can be sensitive to that.
Yes, yes. So from that, I'm imagining that also some people are very sensitive to other things that happen during pregnancy and things that we're advised to do.
Yes, and no wonder we have a remedy now in homeopathy, which is ultrasound as well.
Yes.
So had I known about it long time back, I probably would have used it for myself. And now, for patients who come to me like that with early miscarriages, sometimes this remedy can help. If there's a history of 2 or 3 ultrasounds and then they start bleeding after that, and if there's a repetitive history of that, then that's a cue that you need to use ultrasound and potency for those patients.
Okay. Okay. Yes, it's very interesting, isn't it? So I think it's worth mentioning at this point about the fact that not the same, that everybody will need individual remedies according to their whole health history. Let's talk for a moment just about that, just so that our listeners are understanding that if one remedy is working for one person, it might not be the right remedy for you.
It will never be probably the right remedy for you. That's the problem. Otherwise, we'll just mention the remedy and tell everybody to take it.
Yeah.
It's not that simple at all. And we, even working with a homeopath, and then it takes a bit of time. It's not going to be a quick fix, because it takes about 2.5 months at least. That's one cycle of the egg production. And
Yeah.
if we are to take for, that's why my fertility package that I offer is for 3 to 5 months,
Okay.
because 3 months is the minimum that I need with anybody if I have to improve the status of the ovary, or anything related to the reproductive tract will take a minimum of 3 months, I feel.
Yes, I think you're absolutely right, because also you want to go in at different levels as well, don't you? So we need to know overall health. We need to know how a person's reacting emotionally and physically to the world around them in order to strengthen their whole body. And then specific symptoms that you might be helping, such as irregular periods or
Yes.
very heavy periods or no periods in some cases.
Yes.
So
Yes.
according to what is happening to them, whether it's related to the ovaries and the uterus or not, all of that information is really important for fertility, isn't it?
Yes, absolutely it is. And that's why the first session itself takes so long for us,
Yeah.
because we need to get into that detailed history of patient. Recently, Mary, there's a patient of amenorrhea of long standing. And that's come to me, 10 years standing of amenorrhea, and a young girl.
Yeah.
And she's come to me saying that since I have been going through this for 10 years now, and I didn't bother earlier, but now I'm probably getting into that stage where I might want to have children. So
Yes.
I want to fix my health, fix
Yes.
people feel
Yes.
it's like they can fix something. So, I want to fix this before I go down that road. So I was like, I'm glad you've come at least a little bit prior to that stage in your life so that you'll get some time to actually make some improvements.
And it's such a profound change in health, isn't it? Because I recently had a client who didn't have any periods for many years, and in actual fact then went and had IVF and had two children using IVF, still didn't have any periods, came to
Oh.
me for something else, and as soon as she started having homeopathy, guess what? She started having periods. Um,
Yeah,
so,
yeah.
so it's amazing. It's amazing that change when we are approaching everything very holistically.
Yes. And that's the benefit of homeopathy. When you use it, it's like your overall health is going to be addressed. We don't have tunnel vision. We have to look at everything. There is no going sideways.
And we love it when people come to us in order to become healthy before they want to get pregnant.
Yes,
That
yes.
quite often people come to homeopathy as a last resort, don't they? When they've
Yes.
tried everything else.
Absolutely. So the case we spoke about, it had already had a few IVF cycles when she came to me. So usually we get barely a few months where they think that, okay, everything should be done in these few months and that's it. But yes, sometimes it's not that simple. Sometimes it can be done, but sometimes it's not that simple as well.
Can I go back to before you were saying that homeopathy works in the opposite way from mainstream medicine and IVF? Can you just explain a little bit more about that? Because I think that's a really interesting point that people need to understand.
We are just working with the body. I earlier also said that we are trying to work with the body. Why? Because we are only trying to nudge the body to optimize the pathology, to optimize the physiology, but the body itself will be doing that. We are not doing anything mechanically. IVF is completely a mechanical procedure, of course, and then they, take the use of synthetic hormones in that. Now, I, as a homeopath, believe that we can never know what is the dose of a particular hormone, be it progesterone or any hormone that they're giving. How much is that needed for this woman at this particular time? How much? How can we quantify that? Because it isn't that simple.
It isn't.
Uh,
That's a really good point because with mainstream medicine, they take an average, don't they? It's the same as blood pressure. They take 100 people, work out an average, and say that's what your blood pressure should be. But
big, yes.
you, it might not be. It might be on the higher range, it might be on the lower scale.
I,
So,
for example, I stay at 100/60 all the time.
do
All the time. And that's my normal. I
yeah,
mean,
yeah,
I'm,
yeah,
I'm functioning fine. I'm able to exercise. I'm absolutely fine.
yeah,
But they say that it is hypotension, you
yeah.
know. but
Yes.
it's not. So that's what I'm saying. So I just feel, and I have seen that over the years as well, that we cannot quantify everything
No.
in limits and doses. So we have to have something better, that we can just tailor make that a treatment for a particular patient as to what does this patient really need. Does this patient even have any deficiency of any hormone that we are actually administering? But they are just, if a patient goes for IVF, progesterone, blah, 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 21 days. Like,
Yeah.
it's very, I don't know. I mean, as a homeopath, I don't understand, I feel, that kind of treatment.
I think that's why a lot of doctors question it, don't they? And think, okay, I can see, but they don't have any choice. And it must be very stressful for them to work within those parameters because at the end of the day, we know our own bodies, we know how we feel. And that's what I love about homeopathy, the fact that actually it gives us permission to acknowledge how we are, how we feel, and what is different.
Yes, yes,
And when you speak to clients, they're saying, I love the fact that I can tell you this
yes.
because quite often they can't tell their regular GP.
Yeah.
Um,
They don't have the time to listen to all those details, but we have to make that time
yeah.
because we work on the mind body axis and not just the physical realm. So we have to make time and understand their mental emotional status as well.
Just so that we're clear, Varsha, can you just list a few of the causes of infertility that we see quite often? Because there is a huge range, isn't there? And perhaps people don't really understand that certain things might be affecting their infertility, and that's okay as long as they understand. Um,
Yes. Okay. I will just go into the physical causes because
yeah,
that's what everyone
okay,
understands. Diet is the topmost cause because we are eating a lot of processed food and it is having deleterious effects on all systems of the body, of course, but particularly the reproductive system as well. Then alcohol is another thing that people are very sensitive to. So I would definitely say that try to clean your diet a little bit uh, prior to conception. It's not that now you're pregnant, so now you'll stop having your alcohol or your one-off cigarette if you're having it or if you're smoking. So please try to at least give your body a few months before that. In fact, to be very honest, it's what you're doing your whole life that attributes to the health of your child. But
yes,
obviously, we can't think that long term. So, practically speaking, I would give at least 3 to 4 months to get a clean diet, exercise a little bit, have a decent balance of protein and carbs in your diet, and fix your everyday lifestyle a little bit before you actually think of conception, because ultimately what is most important is a healthy fetus,
yeah,
nothing else, right? We all want a healthy child.
yes,
So we have to be healthy ourselves first
give
and
that.
then go into conception. One. Then there are obviously the organ causes, like this case we discussed. So ovaries were not working,
Yeah,
so to speak. So there are, many things in the history of the patient. There can be like a disease like typhoid, a history of a difficult case of typhoid that happened 10 years back, probably. There could be strangely enough, uh, there was a case, it's just coming to me, it's not very common, of course, but there was a history of a dog bite in that case. And the case was, it was a male patient representing with azoospermia, like no sperm at all in the test. And the only thing in the case was a history of a dog bite. And lysinum was used.
okay,
And that's it.
that's it. That's
That's it.
yeah,
Yeah. So it all normalized the sperm count, etc. It increased the sperm count to an extent that the couple could conceive, you know.
okay,
So that's what I'm saying. So very unexpected things that you can think in the history can be contributing as well.
And so
Uh,
let me just point out here, and just so that our people are understanding, if you have low sperm count, lysine isn't going to be a remedy for you unless you have had a dog
yes,
bite and been affected by that. So
yes,
this is what is different about homeopathy, isn't it? This is what is very, very specific. The
yes.
remedy for you is chosen on what has happened to you emotionally and physically.
Yes. So that's what I'm saying. People don't know this, and it's very unexpected to think that that could have affected me today.
Of
You
course.
know, you think that you took the injections, you did everything, and you're fine. You know,
Yes. Yeah.
but it is not that simple. Then we have obviously fallopian tube defects, the tubal defects that are very common now.
Yes.
The scarring of the tubes, the obstruction of the tubes. So again, now that's pathological completely. So we have to take care of that pathology if we have to normalize the tract and the normal fertilization can happen. So these are, I think, a few common things. And then obviously on the mental emotional level, grief is a big,
Yes.
factor as well, I feel. If there is a history of profound grief, then that can affect fertility in the future as well. So that also, I mean, we do have remedies for that as well. Um, what else, Mary? Why don't you tell me something?
Okay. So
Coming to
one
mind.
that I'm helping somebody with at the moment is that actually the one thing in their history was a car crash. And I gave them arnica, and suddenly they had all of the pains and the strains of the crash come through because they
Oh,
hadn't been resolved at the time. So that needs to be cleared first. So yeah, amazing that everybody is different and the remedies are so personal. And I think that's what we've got to get across. But the amazing thing is, as you said right at the beginning, is this is life-changing. This really can make a difference. And the lovely thing about homeopathy is it's not invasive, it's easy to take,
yes.
it's easy to do with your normal everyday life. It's not expensive. All we need is a little bit of commitment to a little bit of time to getting you back on track and your body back on track.
Absolutely. Absolutely. Bang on correct.
Varsha, it's been so lovely talking to you as always. Thank you so much.
Same here. Thank you again. Thank you for having me.
See you soon. Take care. Thank you, Varsha. It's so lovely talking to you as always. Next week, I will be sharing with you an insight, really the vision for homeopathy, a global homeopathic world. Come and share with me the idea of helping new people learn about the prospect of taking back responsibility of their own health, about learning how they can be perhaps maintaining their own health themselves and learning everything that they can be doing to maintain better health. This is talking about homeopathy and why there is a change in the air, why things are changing with the internet and everything that we've got, all of the resources that we've got available at the moment, and how people's mindset perhaps are turning towards holistic or preventative health. It's going to be an interesting discussion, and I do hope that you'll be able to join me. Thank you. I do hope you've enjoyed these episodes, and I do hope you can subscribe to our channels. Now, there are various ways for you to listen to our podcast or watch it on video on YouTube. So whether it's iTunes, Spotify, or YouTube, please do subscribe and please do leave us a review. If you leave us a review on these platforms, then more people will see our podcast. We just want more people to share the joy of homeopathy. It's a choice that everybody should know about. Please do everything you can to help us help more people.
We hope you enjoyed today's episode and look forward to listening to our next one. Please don't forget to follow our podcast on your chosen channel, and please do leave us a review so we can continue to share homeopathy with as many people as possible. If you do have any questions, please do reach out to us on any of our social platforms mentioned in the show notes. We at Homeopathy 24/7 hope to empower you on your natural health journey.